Good afternoon, everyone. Thanks so much for joining our eClinicalWorks presentation today. We are going to go ahead and get started where I still see folks that are continuing to join. So welcome. We are going to send out a recording of the webinar. So don't worry if there's anything that you have to miss, or if you like what you see and maybe want to forward it on to a colleague, our marketing team will make sure that you get a copy of the recording from the presentation today. So my name, just a quick introduction. My name is Adrienne. I am with Revel. I've been with the company for probably about 13 years now. So I'm really excited to bring this presentation to you today. I have a colleague joining me today, Morgan Nelson. She is an eClinicalWorks expert. So I'm excited for her to share her knowledge with us and give everyone an overview of the system. So I know a lot of you guys probably are just like us sitting at home. Hopefully many of you are able to continue working from your remote locations. So we're glad that you were able to maybe spend your lunch hour with us. I will just go through just a couple of brief slides just to tell you guys a little bit about Revel and eClinicalWorks, and we're going to jump right into the presentation. So I promise I will keep my part brief, and Morgan's going to jump right in and share some really exciting things with eClinicalWorks. I know a lot of you now, and we'll kind of talk a little bit about this, but are probably likely coming from other EHRs, so you're probably pretty savvy. So if you have questions or maybe something pertaining to your specialty, you can utilize the GoTo chat panel. You're welcome to type your questions out there. Likely would like to stay on track because we have a lot of things that we like to cover in a short time. We don't want to keep you too much longer than an hour. So just type those there. I promise we'll get to them at the end. And if they're really specific to your specialty or something that you might need, I may just reach out to you guys as a follow-up, or I will on a one-on-one basis just to make sure your questions are properly answered in detail. So a little bit about Revel. Some of you may have heard of us and some of you likely have not. We actually recently in the last year, we rebranded this year. We used to be a company called Group One Health Source. So we still are the same company. We like to say that we just repainted the house, same ownership, nothing really has changed there, just have a new brand, a new face to our company. As times have changed, we've evolved and changed. So it was just time. So we are now Revel. We are also an eClinicalWorks reseller, and simply really all that means is we do sell the product to practices of all sorts of sizes, specialty, really across the US. And we've worked with nearly practices in, I would say, probably nearly every state at this point in time, and we've been doing that for well over 10 years now. We like to consider ourselves end users of the system. We have been working on eClinicalWorks just like you guys, many of you today as users of your system. So we come to our users and we bring a little bit different expertise when we're going out. We sell eClinicalWorks, Morgan and I do, and then we have our own implementation and training teams that come on site and spend time with the practice to help teach everyone eClinicalWorks, help you kind of customize the system. We like to say we come from a different approach just because we have a bit more of a consulting background, and that's partly because we are also a revenue cycle management company. So we work a lot with practices that may even already use eClinicalWorks, and we provide the revenue cycle management. So just know that today, if your main focus is just really learning about the EMR, that is absolutely something that we can help with. The system itself, as we'll see today when Morgan starts the presentation, it is a fully integrated EMR. So it's going to have your front office scheduling, provider documentation, all the way to be able to submit your own claims out of the system. And then if you decide that it's really not a fit for you guys to have your own internal CBO office, or you want to look at outsource, you might decide to take a peek at Revel, and let's kind of talk through what that might look like working together, as we would really become end users from the back end of your eClinicalWorks system if you decided to explore the revenue cycle option. So again, we can work with you in lots of ways. If you're just focused on EHR, we can definitely help with that. If you're kind of looking for a sort of a combo package where billing service service plus EHR, we can certainly help you there. We have a lot of different pricing options, which we can talk a little bit more about at the end of the webinar, excuse me. And we also provide a lot of eClinicalWorks support for many of our clients, depending on how we work together in the relationship. So moving on just a bit here, I want to talk just briefly for a few moments a little bit about our billing service, just in case any of you guys on the line are considering that. And gosh, with all the changes that are going on right now with COVID, I know a lot of home-based people had to send staff home. You know, if you need any help in those areas, those are things that we would be able to help with. We do partner with our clients. You do get an entire client success team that will work with your practice, a client performance manager that kind of leads your account, gives you a great resource to help with your improvements, reporting. Again, the software is going to have all of that, but what we do is kind of help you, guide you, and help make sense of what all those reports and KPIs are. So that is one resource that you have on your success team. You also have a billing resource consultant, which serves as each one of our clients' main point of contact to really help you with the day-to-day types of things. You get a billing performance lead, a coding resource consultant. That is huge. I'm going to talk a little bit more about that in the next slide, but a coding resource is really something that I find in all of my years working with practices. Coding seems to be something that a lot of practices, physicians really struggle with. We can offer a lot of guidance there, questions, not just only do we review provider notes and help recommendations of codes, but we also help from an educational standpoint, helping providers learn more about coding if that's something that you want. We perform E&M bell curve audits, so lots and lots of value that your day-to-day coder that works on your account alongside with your coding resource consultant on your success team. And then of course your eClinicalWorks trainer. So one of the things that we do best is working with eClinicalWorks, and not only if you're already on the system do we help you optimize use of the system. If you're a brand new user, we're able to go out, help your practice really optimize use of the systems. At this point, many of you are probably, like I said, coming from a platform, so you're already probably a savvy users. Most likely we can really help you utilize all the great things that eClinicalWorks has to offer and really put it in your practice workflow environment. Again, I'm going to focus just a couple seconds here on these next two slides, but there are a lot of different RCM services out there. We like to consider fragmented as a term that we use often, just meaning partial. So some of you may even already have experience working with what we call partial, where maybe some of the RCM responsibilities are left to the practice. A few easy, simple examples would be, hey, if a claim gets denied, are you doing the follow-up? Are you doing the actual coding? Do you have a coding resource or a consultant or a day-to-day coder that helps you with your coding before you submit a claim, or someone that you can go to? Do you have someone that's able to take your patient phone calls? Usually a fragmented RCM model does not generally have those things. We consider ourselves full service end-to-end, so we're going to offer everything from, okay, you've documented your progress note, you've given us your codes, it then goes to the certified coder on our team that reviews, submits the claims, we post the payments, we work any denials on the back end. That is all things that we would handle on the RCM side, nothing that we shift back to the practice. We'll handle the whole patient revenue side as far as sending statements, talking to your patients, taking phone calls. So really the whole back end process is something which we would kind of lump into what we call the full end-to-end RCM model. And then next slide, we'll kind of jump and switch over gears a bit to eClinicalWorks and why eClinicalWorks. So like I said, a lot of you are coming from different EHRs, and in fact 90% of new eClinicalWorks users are customers that are switching from other EHRs, and you can see some of these top ones. Some of you may be using these today. And so generally, we mostly, in most studies that I see, this one came from the American EHR, but we usually fall usually behind Epic. A lot of a lot of hospital systems, so they likely will probably be number one in many of them as far as users coming from Epic or users now. But again, if any of you are on these systems, we're very familiar. A lot of you can see in the others category, a lot of systems that are out there. So we can help you, and we can help you by moving your data out of your current EHR into eClinicalWorks. Those are all things that we can assist it with when you're changing systems. So it is a very comprehensive system. Morgan's going to talk a lot about a lot of these things. We won't, again, have enough time to go into a lot of them in detail, but I do just want to point out that they are there, such as appointment booking online. You have the ability to open up your schedule if you want, so patients can do online appointment booking. Some practices will say, oh, we'll allow requests, but we don't necessarily want a patient put them on the schedule. Totally up to you. There's so much that you can customize or turn off or on, really based on how you at your practice want to do things. Automation of appointment reminders, being able to send our patient text, emails, automate all of that so no one's having to manually do any of that. Kiosks for self check-in. That's been a product that's been around for a long time with eClinicalWorks, but we're seeing it really being used and adopted so much more now. Patient walks in, be able to do the self check-in with your little iPad, even collecting a payment, a copay, without necessarily having to go to the front desk. So that can really help you streamline your check-in process. And referral management, interoperability. So we have a lot of integrations with Commonwealth and Care Quality to pull data from your hospital systems. That's one of those tools that is available without cost. Turn it on in the back end of eClinicalWorks, where you can pull data from your hospital systems. Patient visits, so easy for your patients to have access to the patient portal, provider documentation on the clinical side. We have rules engine, a lot of back office automation. So for those of you who want to do your own revenue cycle, you have your own internal CBO, all the tools that you're going to need are going to be a part of the comprehensive package. Or, you know, we might be another option if you would like to look at an alternative. And of course, the analytics. You get your basic reporting available out of the system, financial. You get a lot of reporting through our registry, and then we have a whole population health module. Is that is something that you're interested in? And then we all know about this telehealth. All of you guys are probably doing that at this point today. A lot of our offices, even some of them have closed, and they're strictly doing telehealth visits. So that is something that we can support. It is easily available with on-demand activation. So any of the eClinicalWorks users today that have been using the system for years or new users, all they had to do was basically self-enable it. It was pretty plug and play to start doing the telehealth providers visits. And you can see we've had a 16-time increase just from March all the way up to April. Look how many minutes, 6.4 million. That's incredible amount of telehealth phone calls that have been going on. So you're covered there should you decide to utilize the telehealth component that is part of eClinicalWorks. And I think we're going to talk a little bit about patient engagement, but we do have the patient portal available in Messenger. We have a Helo app that your patients can download for free. And in fact, talking a little bit about telehealth, providers are now even doing their televisits. They have the option to do it. Same thing with the patient from their phone, the Helo app. That if you want to do the patient visits with their phone, that's certainly an option even outside of the patient portal. So that is all I want to talk about. Morgan, I know I'm saving all the good stuff for you to showcase the product. So I'm going to turn things over to you. So I'll stop showing my screen and allow you to be the presenter. I'm going to flip that over. And it's all yours whenever you're ready.
Alrighty, thanks, Adrienne. Everybody, welcome. As Adrienne said, my name is Morgan Nelson. I've been working with eClinicalWorks for roughly about 10 years now. So while I'd like to consider myself a subject matter expert, there's probably someone out there who knows a lot more than me. So I'm going to go ahead and I'm going to show my screen here. Alrighty. So what we're looking at is eClinicalWorks version 11E, meaning that this is a web-based version. You do have that option, so you don't have to have it that what we oftentimes refer to as an EXE version installed locally on your desktop. You do have the web-based version now. What's great about that, as long as you have access to Google Chrome, you have access to your software. So if you're at home working, or maybe you're in the car and you need to pull something up, as long as you have access to the internet, you'll be able to pull this up. From the window that we're looking at currently, this is what we refer to as the resource schedule in the system. There are two different types of schedules. There's the resource schedule and a clinical schedule. This resource schedule is the one that your front office would be working from, or your schedulers would be working from. You can see my name up here as the provider. You do have the option to have multiple provider schedules open in the database at one time. You can have up to 10. And then you also have the option to have resources. So in addition to a provider schedule, you can have a nurse schedule or a lab schedule, maybe a flu shot clinic, or any of those testing that you do outside of the physician schedule. Okay, so if I were to pull open this lab only, you would then see those two separated up here at the top with the name. You'll also notice that on that lab only, it was all gray, meaning that you can build your working hours in the system. So my working hours are defined in this light blue. You do have the option in the system to customize a lot of times what people refer to as schedule templates. So instead of it having it open like this, where I'm free to schedule any patients, you can actually come through here and you can identify maybe that you want 2 new patients in the morning and 2 new patients in the afternoon, and the rest of your schedule is completely open to any type of an appointment. Okay. As far as scheduling goes, it's a very simple process. You'll notice your times over here on the left-hand side. If you just double click on your time slot, it's going to pull open an appointment window in the system. In the appointment window, you're going to notice every area that has a red asterisk is mandatory. It is real-time search, so as I start to type, I apologize, patient's name, it's going to narrow down my search. If your patient's new to the system, they're not in, that's when you can click this little patient lookup icon right here and add them new to the system. Now you do have the option, Adrienne mentioned patient portal a couple times. You do have the option to allow patients that are new to your practice to go out and pre-register. It's a very simple process. It is attached to that patient portal window, but underneath the login, there's a pre-register option for your patients. Okay. Your facility, your provider, that information defaults based on your working hours. So that blue back here in the background, all of that will pull in for me. Okay, so I don't have to worry about filling that in. My date and time, that's also automatically going to fill in. Now, what you'll notice is that time slot right here will change based on the visit type that I choose. The visit types are customizable. You do get standard ones in the system. You can come out here and you can customize those. You can allow certain visits per provider schedule or per resource schedule. Okay, so if you have a provider that only wants to see new patients and follow-ups and they don't want anything else, you could come out here and you could hide the rest of these visit types that are out there. I'm going to go ahead and click OK just so you can see what it looks like to get my patient on this schedule. You'll notice if I hover over, it gives me a little bit of information. This is handy when you have multiple patients. If you start to double book, triple book, or as your schedule starts to fill up, this information right here may become a little bit harder to read. So that's what this hover is for. It allows you to see that information easily. Now, this is just a simple process of scheduling my patient. When your patient actually comes into the office that day, you're going to double click again. Notice that I keep having alerts pop up on my patient here. These will pop open every time if there's an alert set. For my particular patient, I have them set that they're a drug seeker as well as a work comp case. Now, within this window, you'll notice now that you have on your right-hand side here, you have some patient account inquiry details, okay? This is where you're gonna see if a patient has a copay listed, if they have any balances out there, you can see what is the total account balance versus patient versus insurance, if they have any unposted payments or credits, as well as insurance eligibility and RX eligibility. Now, this can be set up in the system to run automatically. So that information would already be populated there if you had it. If not, you can manually check that. Simple, just hit the check. You'll get this pop-up window here. A simple refresh within seconds will give you that data back. Same thing for your RX eligibility. You can set that to run automatically. If not, then you can just hit check your RX eligibility, and then set your formulary from within this window here. Now, if you're collecting a payment on your patient, maybe I'm collecting that copay. All I have to do is click on that blue hyperlink. It's going to pull open my patient payment window for me, and then I can enter the amount that I'm collecting. If I'm set up to do e-payments, I can click this $ right here and swipe the card directly in the system. Otherwise, if I have an external credit card machine, or if I'm collecting cash or check, I would just determine which method. Let's just say it's cash. You'll notice here that my payment of $20 is applied to today's service date. And at that point, I could either print this receipt, or I could come out here and publish it to the patient's portal. So if you have patients that like to be paperless, they don't want to take any paper with them, you do have the option to publish quite a bit of information out to the patient's portal. Okay, once you've determined which method, it'll bring you back to this window here, and you'll notice again that you have a red hyperlink of payment received. So if maybe you didn't print it and you want to go back and print it now, you can always click that red hyperlink to get back to that window. Otherwise, I'm going to go ahead and mark my patient as arrived, and I'm going to click OK. Real quick before we navigate away from this window here, I do want to show you over here on the left-hand side. This three bar kind of toggle window right here. This is your navigation bar. So this is how you're going to kind of navigate through eClinicalWorks to the different windows. You'll see that you have the admin band over here. This is where you can come out and you can configure eClinical mobile settings, your patient portal settings, your kiosk settings. You have your Helo, which is part of your patient portal. So this is where you can come out and you can really see the analytics behind that. You can determine, how many patients are logging in. If you need to change the overall look of your portal, update your logo, update your practice information, you can come out here and do that. You'll see you have your billing band. So as Adrian mentioned, this is a completely consolidated database. So we have our schedule, we have our clinical component that we'll see here in a minute. And then you also have your back-end stuff for creating and submitting your claims, posting payments, and so forth, okay? Now, in each one of these windows, you'll notice as I click within this header, maybe it's the menu band, maybe it's the registry, there's a star for each one of these. Maybe depending on your role within the office, you don't need to see all of these different navigation bands. You can build favorites within eClinicalWorks, so simply just by clicking that star. And then up here at the top, you can actually filter over to your favorites, so you don't have to see all those other windows anymore. This is where it would stick, so when you log in, you'll see your favorites every day. And then just to get back, you simply just click back there on that arrow. You can always remove something off your favorites by clicking that star and taking it off. Okay, so let's dive into the clinical side. Up here in the top right-hand corner, we have what we refer to as jelly beans in the system. Jelly beans are essentially just tasks. If you have something assigned to you in one of your jelly beans, that means that you have a task essentially that you need to complete. I'll come back to these here and shortly to just briefly go over those, but we're going to work from the S jelly bean. S stands for schedule. So this is going to be your clinical schedule. Similar to your resource schedule that we were looking at earlier, it's going to list all your patients. The difference is these are going to be a list of all patients that you're truly seeing for today. If a patient cancels, reschedules, or no-show, you have the ability to leave them on your resource schedule, but they will disappear off this schedule here because these are going to be our true patients for the day. You'll notice you have a provider filter up here at the top. As a provider, it defaults to your name. As a staff member, you can choose your provider or your resource schedules that you're working with. If you work with more than one, you do have the option to select multiple from that list. You'll notice here that just some basic information. You have your visit type, appointment time, the provider or resource schedule that this patient belongs to. That's what those initials are for here. You have your visit status and your arrival time. So once your patient has been marked as arrived within the system, this duration automatically starts to click, okay? You have the option to communicate with staff through this status option here. There are standard statuses that come in the system. You can create your own, and I always like to show people that by showing this test one that we have out here. If your process within the practice is that the nurse goes in the room first, you could change that to nurse and then just manually enter the room number here. Maybe it's 2. Okay. At that point, I'm just going to double click on my patient's name and it's going to bring me directly into the patient's progress note. Now, whether it's a nurse visit, a lab visit, or an actual provider's appointment, the process to document on the patient is going to be the same. The patient gets scheduled, you go to your S jelly bean, you double click on their name, it brings you into this window here. The way that this window looks could be slightly different. You'll notice we have all these orange headers here within our progress note. You can hide these headers based on the visit type that the patient's coming in for. So if it's a nurse visit and we don't need all of this information, we can customize this particular progress note for that visit type, so not all of that is out there. Across the top here, we have what we refer to as a patient's dashboard. Your patient's picture will show here in this little gray icon, patient's name and just some basic information on the patient. You have your sticky notes over here to the right. Okay, a lot of this data pulls from demographics or other areas in the system like their account inquiry. This green one right here, you can see it's pulling their primary insurance and what the total account balance is. Global notes and secure notes are just true sticky note fields. So you can come out here and you can type a note. And then the very last one, your Helo, is tied to your patient's portal, okay? So it is going to provide you with a little bit of analytics here showing you the last time your patient's logged in, as well as you have this little red download button. So if you choose to build any questionnaires out on your patient's portal, maybe it's your review of systems or you decide to add any tracker information, that's where that download button will come into play, because then you can import that data into today's progress note. So if they did fill out a review of systems, okay, ahead of time, especially with your new patients, maybe they filled that out, and now as the nurse, this is part of my workflow, I'm gonna go ahead and click import current page, and it'll populate those fields in my progress note for today. On your right-hand side, you have what we refer to as the right-hand chart panel. You'll notice there's a couple different tabs in here. I'm just going to quickly kind of touch base on those. The overview tab here, again, you'll see any alerts set on your patient. Your problem list, as you start to diagnose your patient, if those problems are marked as chronic, they'll automatically get published to the problem list. Otherwise, you do have the option to manually add a diagnosis code to the problem list. What's nice about this then is you don't have to keep searching for those diagnosis codes. If you know that patient's automatically going to be returning today for this headache diagnosis, all I have to do is click that orange arrow and it's going to shoot it back into today's progress note underneath the assessment section for me. When I scroll down, I also see I have my medication summary. The medication summary does pull from current medications or medication history, okay? So you can see here it defaults by date, but if you want to filter that by medication or by provider, you can certainly do that. What's nice about this is if you allow your nurses to queue up any medications within your system, as a patient, I come in and I say, I need a refill on my aspirin. The nurse could come over here on the right-hand side, click that R for refill on aspirin. And again, it's going to queue that up in today's progress note. It's going to pull it down here. You can see it's pulled the last diagnosis code that it was associated to, and it pulls that aspirin in the exact same way it was prescribed the last time. It hasn't sent the prescription yet. It's just queued it up in that treatment window for you. You also have the option to mark prescription as continued or stopped from here. You have just an overview of immunizations or any therapeutic injections that may have happened. Your next tab over is an encounters tab. So mine is currently filtered by the last 3 months. I can change this to the 6 months, 1 year, or 2 years. It is a sticky field, meaning that once you switch it, it stays, okay? This is gonna show me last labs, diagnostics, procedures, all telephone encounters, web encounters, which come from the patient's portal, any referrals, documents, actions, or records that have come into the system on this patient. What's nice about this, if you have a patient who is returning to the clinic today for a follow-up on labs, once those labs or diagnostics have been marked reviewed in the system, you'll notice here that it places an arrow next to them. The first arrow is going to pull in this CBC right here specifically. The second arrow would pull in a cumulative report. It'll pull in the last 3 CBCs that have been done on this patient. Let's see if I have, let's do the last 2 years. And I have 2 CBCs. So if I click this arrow here, it's going to pull it into my progress note for me underneath the past results section where it says the CBC and the date. And it looks like maybe that second CBC didn't have any data on it, and that's why I didn't pull it in here. But so if it does pull in a cumulative report, it's going to pull in all 3 of those with the date listed out here for you. If you accidentally pulled it in, it's a very easy process to just go out there and remove it off of your order for today, or I'm sorry, your note for today. It doesn't remove it out of the patient's chart, it just takes it off of the note. Your history tab is just saving your patient's history as you start to document on that. You can click, again, any arrow in the system like this. What that's doing is that's just merging that data back into today's progress note. Your CDSS tab, this is for Clinical Decision Support System. This is an alerts tab. So there are several different alerts that you can turn on in the system. There's system generated alerts, which are based off of age and gender. You would enable those to what's appropriate for your practice. they will show if your patient is due for those. So for example, the pneumococcal vaccine. Once I gave my patient the pneumococcal vaccine and I said it was completed, it would suppress this alert until it was due again, okay? Maybe it's the depression screening, that's due annually. So that would pop up the next time it was due. You have practice created alerts, meaning those are the ones that you create in your system. Again, you can build those based off of age and gender. And then the other one that's not showing is patient specific alerts. So if you have a patient maybe that needs to come back in to have their hemoglobin checked in 3 weeks, you can create a specific alert for that particular patient. It will show here, as well as over here on your right hand side, you can come out to your registry and you can recall patients based off of specific alerts. Order sets and templates, these last two tabs right here, both of these are a favorites. So there are pre-built order sets and pre-built templates in this system. You can use the ones that exist. You can go out there and take the ones that exist and customize them and make them your own. You can copy another staff member's templates. It's entirely up to you. Possibilities truly are endless with those. But once it's added over here on your right-hand side, this is what you have considered as a favorite, okay? If you wanted to use this order set, you can just click the OS right here. When it pops open the order set, you'll notice diagnosis codes on the patient's problem list versus diagnosis codes that have been linked to this particular order set. You would choose the appropriate code, click OK. It's going to pop open your order set for you. And then this is just possible treatment options for that particular diagnosis. Now, like I said, there are pre-built ones out there, so they can be diagnosis specific, or you can just build a generic favorite order set in the system as well. So maybe I want to prescribe this medication, I want to order this lab, and I want my patient to return for a follow-up in 2 weeks. I would just go through, check those boxes, and hit order selected up here in the top right-hand corner. Once I do that, and I scroll down, you'll see all of my diagnosis and my orders have pulled down here into the assessment and treatment window for me. Now, a template, you can link an order set and a template together. So I just used that chest pain order set. I could have linked that to my chest pain template as well, meaning that once I pulled that template in, it would trigger that there's an order set available and I can select from that actual order set. Now, the way a template works in the system, you can template one particular section of a progress note, like I have a review of systems template right here, or you can template an entire progress note, excluding any patient-specific data like current medications, histories, that type of thing. I'm going to use my chest pain one here. It's at the top of the list. I'm going to click that orange arrow, and it's going to pull in what I have built as my template. Okay, so I can see here there is a chest pain header, but it's blank, and I'll come back to that. I have a review of systems with a couple of items here you'll notice that have been listed as admits. I have an exam, I have a diagnosis code and a treatment, so it pulled that echocardiogram in. And then if I come down here, it's also pulled my CPT code and my next appointment for me. Okay, I'm going to scroll back up here just to kind of discuss the HPI with you. There are several different ways that you can document within eClinicalWorks. We have, you have the option just to kind of free text within a generic notes field, which is why this is blank right here. There are pre-built categories out in each one of these windows that you can use. We also have something called eClinicalWorks Scribe. So very similar to Dragon, Scribe is already pre-built into the system. There is a little bit of data setup that are a little bit of setup that you have to do, kind of like training your Dragon. You kind of have to do a little bit of training within the system, but it works very similar to that. You also have a Scribe feature within each one of these windows. So if I click on this little edit button right here, it pulls open my chest pain category, and you'll notice that there's this start stop dictation right here. So this is where I could come out and I could start to scribe or essentially dictate if I didn't want to actually free text. Otherwise, I can just free text in this notes field and I can click OK. Now, if you do have Dragon, you don't have to use the Scribe functionality, or you can actually use them in conjunction with each other. Scribe does have some Dragon macros that can be downloaded, and it does enhance the feature of the Scribe component of the system. So they do work really well together. Otherwise, if you do have Dragon, it's very similar to the way you would use it now. You'd have your Dragon bar up here across the top. Anywhere that you can type in eClinicalWorks, you can use Dragon. I would go ahead and click OK. If I did want to add more categories, if I click on that HPI header here, it's going to pull open this HPI window. You'll notice over here we have a couple categories. We have some pre-built categories, and then we have some custom ones that we've kind of built on our own. But you can see that they kind of categorize everything based on specialty here. This can be customized for your system, so you can hide based on provider, or you can hide based on as a practice as a whole. If you only wanted just one category in HPI called today's visit, so that way you can come out here and you can free text or use Dragon, you can certainly do that. You also have the option for your kind of a point and click. You'll notice up here underneath the system, you'll click in the notes. There's a free text here, or you can pre-build some custom default answers or macros right here on the left-hand side. Okay. Now for the chief complaint, the medical history, I do want to kind of show you this real quick before we move any further. Chief complaint does pull from the reason on the appointment. So if your patient said that they were coming in for chest pain, it would actually just say chest pain here. Now you can hit enter and add in another line. You can type as much as you want in there. It's not going to stop you from that. On the bottom right-hand corner, if you click that med reconciliation, the system's just going to walk you through essentially what it's designed as maybe a nurse or an MA's role. Now that does vary from practice to practice. So some providers complete these windows, some don't. But as you start to click through these windows, it's going to automatically carry forward that previous data for you. So all of my current medications that are listed on my patient, maybe my patient's no longer on this ibuprofen, but everything else. So I'm going to hit the T for taking, but then I'm going to click on this D for discontinued. What that's going to do is it's going to move it to a new status on today's progress note. It's still going to be in the patient's history, but the next time the patient comes in, this will no longer be on that current medication list. Up here at the top, you'll notice past RX history. So if something like that does happen, you can always pull it back forward. You can see based on medication, based on date, or you can group by medication name, very similar to your right-hand chart panel. And then all you have to do is click the T for taking and it pulls it back in. You also have what we refer to as external RX history. The external RX history works with your RX eligibility. So once you have RX eligibility turned on for your patient and you've set that formulary, the external RX history will allow you to pull forward medications that your patient's on as long as it's been picked up by insurance at a pharmacy. Okay, if they paid cash with that, it doesn't pull to that system, but everything else does. So, every now and then you may have a patient that says, oh, new thyroid medication, but I don't know the name of it. That's where your external RX history will come into play, and you can pull forward that previous data. Again, as I start to click through these windows, it's going to just pull forward that previous information. I can go through and verify these windows. I can add to if I need to. I'm going to close this just so you can see everything that's pulled in. You'll see that discontinued down here and all my current medications at the top. Now, the review systems I chose to make part of my template. However, you can separate that as I mentioned before. So maybe your nurse or your MA does the review systems. They could pull in a template for that, and then you could have your template separate. If you wanted to add, very similar, you just click on the review systems header here, and then you'll see your different categories up here at the top. You can customize those as you need to. You can add to a section. So maybe I need to add more to the cardiovascular section. Other than what was in there, I want to add dizziness maybe. So I can come out here to dizziness, say admits, and click OK. You'll notice that we have in our system, we have it set up for those positives to show up in red and bold, so they stand out in the note a little bit. You do have the option to customize that. They don't have to be red. They could be purple if you really wanted them to. So you can change that. Again, maybe my patient also says that they have fatigue, so I can click on denies easily for my progress note and just change it to admits. So I don't have to go into that window. Your vitals, typically, your nurse or your MA would do those vitals. Anything that has been completed as a provider previously before coming into the room can always be updated. So if I need to go in there and say, no, their temperature was actually 98.2 instead of 98.6, I could come out there and change that, okay? Anything that is abnormal, so Let me just fill a couple of these in. Let's do high blood pressure today. And alrighty, I'm going to close that. All right, so anything that is abnormal or maybe that's a little bit out of range, you can have stand out in that red. Okay, so you'll see all of my different vitals sitting out here. You can build those parameters in the system based on age and gender for your patients. You do have the option to customize that. And then you do have an option to actually customize the vitals that show in this window as well. So you can see when I go into this window, we have a lot of vital options. You can hide any of those categories that are out there or just rearrange them if you need to. All right, I'm going to scroll down here. So the exam did pull in from my review or from my template. It's very similar to the review of systems HPI. You can always come out here to your exam window, add more to a category. You have your edit option here. The one thing that you notice within the system, you have what we refer to as carrots, these little yellow drop downs. So if I did not pull in a template and I wanted to just pull forward a previous exam, that's what that little drop down is going to be there for. Okay, it is going to show you any previous encounters on this particular provider or for all providers for this patient. Okay, and then you can determine, do I want to merge forward the general exam from this date, or in a review of systems case, if I come back up here, you have the option to merge forward particular sections. Okay, so you can see these different plus signs here are showing me from different dates. So if I wanted this general and constitutional, but I wanted this neurologic, I could choose the option to merge those forward. Your diagnoses, okay? Now, other than pulling from a template, an order set, or your patient's problem list, if it's not on any of those, then you're gonna wanna come up here and you're gonna search for your diagnosis code. Okay, I'm gonna type in back pain because I have it quickly in my head here. As you start to type in a diagnosis code, it's going to narrow down your search, and anything with the blue hyperlink is going to pull open this advanced search window for you. This is going to allow you to really narrow it down. With ICD-10, it's just nearly impossible to remember all of those different diagnosis code options that are out there. So this is where you can say it's low, it's acute, it's on, it's bilateral, and without sciatica. Okay, so now it has given me this diagnosis. So I would select that code, click OK. Okay, it's now selected it for today's assessment, but maybe that's a code that I use frequently. Over here on your right-hand side, you have the option to add these codes to your favorites list, so you don't have to search for it every single time, okay? And as I mentioned with the problem list, if it's something that is automatically marked as acute in the system, it will be added automatically. Otherwise, this is where this box will come in. You can just add it to the problem list or cancel it if you need to. All right. Now, to show you how that favorites does work, up here at the top, this is your little favorites button. This is going to start to show you all your diagnosis codes on your favorites. As you start to type in the word back pain, it's going to narrow down my search and show me all diagnosis codes on my favorite for pain. And then you would just select from there. Let's close this window and let's come down here to the treatment window. So your treatment window, let's just say it's kind of like your meat and potatoes of the system. So this is where you are going to prescribe all your medications, you're going to order all your tests, your referrals are going to be done from here, your education is going to be done from here. If it's not already part of a template or an order set, that's when you would come out to this window and you would manually add a medication, a lab, a diagnostics, or even a referral if you need to. You'll notice that you have each of your diagnosis codes here, okay? Next to each one of those, you have OS for order set, you have this little E for eClinicals, and then you have a notes section. So maybe you didn't have an order set on your right-hand side, but now you want to see if there's an order set available. You can click on that OS. It'll bring you out to the main order set window, and you can scroll through that list that's out there. Okay. In addition to that, we have what we refer to as eClinicals in the system. eClinicals is great, especially for maybe new providers to the practice or maybe nurse practitioners who are just starting out and they kind of want to get a feel for how maybe their supervising provider does things within a practice. The eClinicals option allows you to see how, for a specific diagnosis code, how one provider or all providers have treated that diagnosis code in the past, or you can look patient specific. Okay, patient specific will show you how this particular patient has been treated in the past for this particular diagnosis code. And at that point, very similar to an order set, you would just go through, check what you want, and then hit order selected up here in the top right-hand corner. Now, the notes section next to those, this is where you can add, this is great for patient instructions, over-the-counter type instructions for your patient. That's what you have noticed. You'll have two different notes sections here. You have this notes up at the top, which is for the patient, and then you have this clinical note, which stays on the progress note. Okay, so any kind of maybe miscellaneous note that you want to add into the actual progress note under the treatment section, but you don't want the patient to see, you would want to add here underneath clinical notes. This up here is visible to your patient on both their patient visit summary, the patient portal, anything that's published for the patient to actually view, that note there will actually show for them. Okay. Now maybe I want to add a medication. If I come up here to RX, it's going to pull up in my main management orders window for me. Notice that there's a star. So again, you can build a favorites for medications individually. This is user specific, so it's your particular favorites and not everyone else's. You can search for a medication. As you start to search for your medication, you'll notice if something's already on your favorites, it has a star up here at the top. That's your favorited option. And then you have the standard medication or standard doses listed down here at the bottom. The pencil will allow you to edit it this one time for your patient. Okay, so you would go through, maybe you want to say that it's for 15 days instead of, or dispense 15 instead of 30. We're on a trial, let's just say. But you notice at that point, maybe this is a common way that you prescribe something, you can click that add as favorite at that point right there. Okay. Once it's been added to your favorites, it'll show back up here at the top the way that you like to prescribe it. Okay. Now, instead of clicking OK down here in the bottom right-hand corner, over here on the top right, I can just flip over to medication summary if I quickly wanted to get to their current medications. It takes just a second to load. I apologize. There we go. So this is going to show me by date, or again, you can filter by medication provider or by diagnosis code. Okay. And then you have your C for continue, R for refill, refill 30 days, refill 90 days, and S for stop. So any of those that you click on, it's going to pull it down here into today's selected medications. Now, if I want to add a new lab, I can flip over here to add new order. This filters by labs, diagnostics, and procedures. And again, you have a favorites within this window. So once you turn your favorites on, you can start to search for favorites in the system. If you have anything that is considered in-house or maybe that you're going to bill for, you can identify that in the system. You can see here in IH next to in-house. When you click on something that maybe is in-house or that you do bill for, you can associate the CPT code. So you don't have to worry about selecting those from a different window or maybe pulling them from a sheet. We can just have them set up to automatically drop. So that's one less thing that you have to remember. Once you order that item, okay, you'll notice it pulls over here for today's orders. You do have the option to order for future if you need to. If you have an interface set up with maybe both LabCorp and Quest, it will list out which order is associated to which lab company. So you can see here, it would say maybe CBC LabCorp, CBC Quest. Click close. Any drug interactions that are in the system will pop up. You can do with those what you like. You can close this window. You can print it for the patients if you need to. I'm going to go ahead and click OK, and I'm going to show you what the education window looks like here. So up here in the top right-hand corner, you have your patient education option. That's going to pull us out to a platform called Santova. What's great about Santova is it allows you not only to publish just printed material for your patient, as well as videos. So based on the diagnosis codes that are out there, maybe medications that you've selected or tests, it is going to select education material for you or recommend it. You can click on those. So you can see here, this is a video. This is a document. So if I were to click on this, I can scroll down and preview that document. I can print it in larger font if I need to. Everything that is selected, I would then be able to say publish to patient's portal right here. Or otherwise I would want to click on it to print that document. Okay, now you don't have to use what's selected out here. You can deselect all, and then you can come up here and search for education if you want to. You also have the option to build a favorites over time. Okay, if you need to switch that to Spanish, you do have that option up here in the top right hand corner as well. Now, to send your items within the system, we have a great option called the common send window. So rather than, clicking on send prescription, send labs, send progress note, it's all within one window here. So based on the type of prescription and the pharmacy that maybe you're sending it to, the system will recognize if it's an e-prescribable medication or not. You can prescribe controlled medications within eClinicalWorks. So as long as you're set up and registered to do that, you will be able to prescribe those medications out with your token. If it's a lab that's going to one of the interface lab companies, it will default to e-transmit instead. So you'll see here you have your different options. You would just go through, check what you wanted to send, and then hit send down here in the bottom right hand corner. All right, so let me close that treatment window here. I'm going to scroll down. If you're giving any immunizations or therapeutic injections within your office, you do have, it really doesn't matter which one you click on, they take you to the same window. You'll see here therapeutic injections or immunizations. You do have the option to build a favorites in here as well. So I'm just going to go ahead and I'm going to give my patient a flu shot. I'm going to say that it's administered. I'm going to say I gave it, and then I'm going to say okay. Okay, so you can see here it was documented for today. Obviously, we would want to fill out more information. But once you do that, once you have given your flu shot, it pulls those CPT codes down here to the bottom to the procedure window for you. So the great thing with eClinicalWorks is that everything that you're going to be doing in-house, you can link those CPT codes, whether it be a procedure, a diagnostic, an immunization. You can link it to the actual order, or you can add it in on a template if needed for some reason. Okay, down here within your next appointment window then. So next appointment, visit code, procedure code, they all bring us to that same window. Okay, within this window, we'll see all of our diagnosis codes that we've used on our patient, all of our CPT codes that we've used on our patient. I had 2 follow-ups in here, but I could easily say I want them to come back in 1 week by clicking that button, or I can free text in here. Maybe I want to say 3 weeks. And then the reason with labs. Okay. If you have any notes that you want to leave for the billing office at the claim level, you can do that here. These do show up at the claim, so they'll be able to see that. So if you need to add another diagnosis code, you can do add ICD, you could do add CPT. There's a quick add option by just typing right here within these fields. Otherwise, you have the option to do the E&M coder or add E&M. Okay, I'm just going to go ahead and select my level here, click OK, and I'm going to mark my note done. Now, you may get some pop-ups. You haven't assigned ICDs correctly. You can click through that. Ideally, we would want to set it up so everything links. But this window here, so if you haven't sent your items, your common send window will pop open again, prompting you to send those medications or those labs that you haven't sent. You can close this and you can come back and send them at a later date. It's not going to prevent you from moving on to your next patient. Okay. I've marked my progress note is done. Okay, I filled everything out that I wanted to fill out. If I come back here to my S Jelly Bean, you're going to notice over here on my right hand side then that I have a check mark. At the end of the day, or maybe end of the morning, whatever that process may be, once all of your notes have been marked done, so they have those check marks, you can actually come out here and lock all your progress notes at one time. Okay, so I could just hit this lock progress note and it would lock all of my notes for me. Back to the resource schedule. So our patient is done. Okay, they can check out. When I double click back on my patient's appointment here, again, it's going to pull open any of those alerts that I have. But now you see our follow-up right here. So follow-up 3 weeks, reason with labs. I could search from this window and I could search for multiple appointment slots that may be available, or If I didn't want to do that, I could just go ahead and say, check my patient out, click OK, and then I can flip through my calendar here to search for available appointment times. You have a couple different options. To publish or to print your patient's visit summary, it's a very simple right click. To hit print summary, you can customize what actually prints on that summary. And if your patient doesn't want it, you can just simply hit publish to portal. And that is our eClinicalWorks. Do we have any questions?
Morgan, I don't see any questions so far, but go ahead and let's keep that chat panel open real quick. If you don't mind flipping over to my screen, I just want to quickly just run through pricing since we have a couple options.
Absolutely.
And I'm sure everyone is curious about how the pricing works. So let's see here.
Okay, you should be able to now.
Okay, perfect. Okay, I have a pricing screen up and I just want to briefly touch on this and just let us know if you have any questions. You can just shoot us an email back from any of those email reminders that you've been getting, or I think a survey may pop up too as soon as you log out, but just let us know. It is helpful to know how many providers that you do have, including mid-levels or like NPs or PAs. We only price on licensing based on provider with an unlimited number of user. We do have a few different options. Really, like I said at the beginning, depending on what your budget is, whether you want to do your own billing or whether you don't want to do your own billing. We have a subscription-based pricing, which simply just covers your eClinicalWorks, PM, EMR, a data migration. That's this $5.99 package. That's the basic one. And there's a plus package that includes a lot of the things that I mentioned at the very beginning, like your kiosk, your Scribe options. So several things that many practices end up wanting. So let us know, but that's probably one of our most popular, especially if you want to handle your own revenue cycle in-house, just that easy way to get started without any upfront costs, including a migration, moving from your system. If you are on one to a new one, we can help with the data transfer side. If you happen to be someone that might be interested in exploring the billing service option with us, that we have a one rate plan where basically we include a licensing, we pay for a portion of a licensing cost, and then a percentage of collections on the billing. So with that one, we need some more details on the practice because the percentage range is going to vary a bit from practice to practice, depending upon your volume. And collections and number of providers and all sorts of things. So let us know, and Morgan and I would be happy to let you know what information would be helpful so we can get you a custom quote for the one rate. And then we have a purchase option where you are able to buy a license upfront, $10K for the first provider, $5K for each additional license after that, and there would be support and maintenance costs on a monthly basis outside of the purchase option. So those are just three of our most popular pricing options. I would say one rate and subscription tend to be what most practices tend to go with, at least at this point in time these days. So let us know if you're interested in any of these or have questions. It does help for us to know a little bit more information about your practice. So we'll be happy to follow up with you if you would like to schedule just a quick call to run through pricing, or of course any questions that you might have as far as functionality of the system. Both Morgan and I would be happy to kind of jump online with you again and run through some more details. So I'll pause for a moment and see if anyone has any questions. I don't think I've seen any come through yet. Let me check our question board. Okay, I don't see any yet. Morgan, was there anything else that you wanted to mention today before we log out? Any questions or anything that you wanted to run through before we head out if there's no questions?
No, just to kind of add to what Adrienne said, if you are interested in, maybe doing a more personal one-on-one, you have more questions on the system, or maybe you want to see the features of the kiosk or eClinical mobile a little bit in detail, certainly reach out to us. We'd be happy to get that scheduled.
Yeah, absolutely. And especially I know telehealth is at the front of probably a lot of everyone's mind too. The nice thing about like I said, and Morgan talked a little bit of telehealth, it is as simple as within the progress note that Morgan did documentation with it. The live video feed pops right up to the right of the screen. Super easy to get started. You can do it through the web-based platform or even, like I said, your phone. So it's real easy to get started on that. So if you're you're needing a telehealth solution, we can offer that even as a standalone option, but it is also an integrated to the comprehensive platform. So let us know if you have more questions. We can even schedule a follow-up, just kind of running through telehealth if that's something that is of interest to you. Let us know. All right, well, I don't see any more questions. So we'll go ahead and close out today. We will follow up with a recording of the webinar, so you will get that. And as Morgan said, if you have any questions on specific components, maybe we just touched at very high level and you need to see it, we'd be happy to schedule a one-on-one time with you. You just have to reach out to us and let us know. And you can do that really just by applying to any of those webinar reminders that you've been getting, and you'll get a follow-up email too with the recording. So you can reply back to that too. So real easy to get a hold of us to schedule a follow-up meeting. So we appreciate your time, guys. Thank you so much. Enjoy the rest of your day. We appreciate you spending a little bit of time with us, and let us know if there's anything else that we can do to help your practice as far as eClinicalWorks or the optional billing service option. Have a wonderful day.